Hi guys and welcome to my channel. My name is Tuya. For those who are tuning in for the first time, I welcome you, and for returning viewers, thank you so much for being part of my YouTube family. So in this video, it is a breakdown of a 1-hour conversation. We're talking about foreign trained nurses coming to the United States to work. So in one of the clips, I have divided this video into 4 clips because it's too long for 1 hour. So in this clip, I have a guest called Zeph, who is a nurse here in the United States. And he's going to talk about the challenges of nursing here in America if you are foreign trained. So you will hear me talk about, oh, I'm talking to Kenyans, but actually the challenges that Zeph discusses in this video will affect every foreign trained nurse coming from the third world country. So if you're from a third world country, these are the possible challenges that you will face if you come here to work as a nurse. So how do you become a foreign trained nurse? How do you immigrate from your country to America to become a nurse? In one of the clips I talked about, you do an exam called NCLEX, and that exam can be done, if you're outside the country, can be done in South Africa and can be done in India. So once you pass that exam, you can either go through an agency, a hiring agency, or you can look for an employer directly online. Once you pass that exam, you can come here to America to work as a nurse. So in this video, like I said, we're going to talk about the challenges that you might face as a foreign trained nurse. So I hope this is useful to you. At the end of the video, please be sure to like it, comment, ask any questions. Thank you so much.
Like nothing, not even a pen.
Okay.
So when you get in there, it is gonna be all you.
It's you, your
and the
brain,
computer.
and your God.
And the computer.
No God. It's you,
Yeah.
yourself, and God. Okay, so what do you think are the challenges? I think I'm hearing you say, you said one challenge is if people in Kenya study to pass exams.
Mm-hmm.
So that's one challenge. What other challenge do you think might face a Kenyan? We're talking to Kenyans.
Mm-hmm.
Who has done MTC or even has become a nurse after MTC. What other challenges do you see that they will face when doing NCLEX?
So the thing is, some of the things we do in Kenya theoretically, but here nurses who study in US will see those things when they go for clinical. So, and I'll give you a number of examples. I do some of the things I don't know, maybe, so you will correct me and bear with me if I mention something that you are familiar with and it is in Kenya. So I can talk about example. I've never seen, I've gone to some places in Kenya and I haven't seen what they call IS, incentive spirometer.
Can you say that again? IS what?
Incentive spirometer.
Incentives parameter.
Yeah.
If you have it in your hospital and
Maybe there.
you're in
Yeah.
Kenya, please comment below.
Well, it could be there. I don't want to assume,
Yeah.
but let's say that thing doesn't exist
Okay.
there. Then it's gonna be really hard for you. Will just be reading. You haven't really seen somebody.
You don't know how it
using.
looks like.
Yeah. Or maybe so many other things. You know, my patients at night, nurses here in US, we do EKG, 12 lead EKG at night.
What is that?
It's just EKG. There is no other name I can tell you.
Oh, okay.
It's a complete name, but EKG is not. It's
Okay.
just for measuring your rhythm.
Oh yeah.
Yeah. So
See?
so
I don't know.
EKG
Yeah.
is a longer name,
Okay.
but well,
I think I
there
know
is a
it.
complete name.
I
but,
think I know it. They even have it for the brain too. Like
Yeah.
for the-
So
for the-
that one is ECG.
Oh, okay. See?
Yeah. Or EEG.
Okay.
So the EKG, need to know how to do those. So you know how to arrange all the 12 leads and where to put them.
So they will test you on those.
No, they won't test you on those, but a question can come in a certain way, testing you about the
That
knowledge
you
on
will
EKG.
need to have known and handled.
Yeah, so for
that
you, if you study
part.
that thing theoretically, it might be harder for you to say, what the hell is EKG? So, I'm just giving an example. It doesn't have to be
Oh,
that.
definitely.
Yes, it doesn't have to be that. So I see so many patients when you are in the floor going through the laparoscopy surgery. So, and I know what it is. I know how it's done.
You've handled
I know when the patient come out of surgery. If a patient went through a lab chole, I know what to do and I know what to assess.
And that's you as a nurse, and also if there was a nurse student here in the US,
We'll know those
will
things.
have seen them
Yes.
during clinicals.
Definitely.
Oh, okay.
So it becomes challenging in Kenya because I know lab choles are very less. Maybe they could be found in Nairobi or Eldoret or some big cities, but not everywhere in Kenya. You can find that because it's a newer technology. It's less invasive abdominal surgery.
Okay.
So those kind of things.
Challenges,
Yeah.
okay.
So it's not gonna be an open surgery. It is a laparoscopy procedure, and you will. I just gave an example. There are tons of things that we do that probably are not gonna be available in the regular setting, clinical setting
In a
Kenya.
hospital in Kenya. Or
Yeah.
a clinic.
So it's gonna be challenging for you because you will need to read it harder and try to really understand what it is because it's going to be a new system. You're gonna come to United States. You're gonna go to patient's room, and you have all the connection in the wall. You have the blood pressure machine connected to the monitor in the wall. You have the EKG or whatever, the telemetry box, and all those kind of stuff. You need to. It's gonna be a newer environment because probably in the real life situation in Kenya,
You
these
didn't
things
have an
aren't there.
experience. Yeah.
But you probably studied in school, but theoretically and not practically. So that could be the only missing challenge,
Okay.
which I'm not gonna say that people won't pass, they will pass. I think the greatest challenge is the critical thinking
Pass.
style.
Okay.
And that's how people fail. And I spoke to one person, and this person told me that the most challenging thing in Kenya would be passing the cardiac. I don't know, because cardiac is more cardiac is really very
Specialized?
I wouldn't even say specialized, but in US it involves a lot of things, and there are so many cases. People coming with a congestive heart failure, people coming with a myocardial infarction, that's a cardiac arrest, and people coming with so many other health conditions.
So do you feel that that's a disease of the West more than it is for
It's
Africa?
becoming all over.
And they are not, probably someone in Kenya doesn't have more experience in that? Is that what you're saying?
So what I'm saying is in US, the diagnosis, you go to for regular clinic, and the doctor will tell you, hey, you have a heart murmur. In Kenya, you would go for the same clinic, and the doctor will not catch it.
Why? Because of the machines?
Or maybe they don't pay attention to that. So once the doctor realizes that you have got probably a chronic situation, or maybe whenever you go to any clinic in US and you say, hey, they're gonna check you and they determine immediately that they need to do the EKG to determine your cardiac rhythm. And then from there, they'll discover maybe you have what they call atrial fibrillation. Now you are a very high risk for blood clots.
Okay.
And there is no way you can be having that condition as a chronic problem, atrial fibrillation, and go home without anticoagulants. like warfarin, like Aloquis, and that kind of medication.
Okay.
Because you're gonna get stroke definitely. That is a time bomb. So in US, those things are cotton. At the earliest time, in most cases they catch it.
Okay.
Either way they catch it. But somebody would just die in Kenya, collapse and die, and we don't know why they died.
They died. Okay.
It's because maybe somebody had a background of atrial fibrillation, but nobody caught it.
Okay. Okay.
Yeah, nobody got it, and that person stayed, developed blood clots, got pulmonary embolism, or got whatever, CVA.
Okay.
Yeah.
So you think the challenge, from your experience, what you're saying is the Kenyans from Kenya, who've done NCLEX said they found the challenge to be cardiology is because of the diagnosis in Kenya.
It's because we do less for cardiac patients in Kenya.
The experience.
But otherwise, it's not because that we don't have cardiac issues in Kenya. We have them, but very little are addressed.
Okay.
Yes.
Okay.
Yeah, there's those cases. They are there, but
so if they are not addressed, then as a nurse you don't get.
Then
the
you just go
experience.
to Then you just go to hospital, and you don't address those cases.
Okay.
Yeah.
So how do they? So with those challenges, how can someone who is watching MTC nurse, how can they help themselves, like go ahead, challenge that challenge?
So I would say just try to find out even from people who have done the NCLEX in the past. And again, like I said, read far and wide, watch YouTube. There are very, very nice YouTube channels like Dr. Sarah. She doesn't call herself Dr. Sarah, but if you say Sarah NCLEX.
Sarah NCLEX on YouTube or online.
It's gonna pop
up. Okay.
Or maybe they call it nursing.com.
Nursing.com. And you say, I think you said nursing.com pays. You have to pay.
You maybe pay a little bit to access more stuff. Okay. But there are free videos that you can watch about cardiac, about EKG, about all those things that you really need to know before you go and do a NCLEX. Okay. And just I would say for you to really pass is just learning NCLEX style of questioning.
NCLEX style of questioning. So that means preparation.
It means preparation.
Preparation.
And go there with the mind that all questions in nursing are correct. You choose the best.
Can somebody buy books online? Is it online? Can they buy
I think
books to study?
You can do online. I don't know if Amazon really ships stuff to Kenya. I doubt.
They do.
They do nowadays?
Yeah, they do. I've seen people online talk about, I got this from Amazon. I think they do it through FedEx or something like that. I don't know, but I think they do. And if they don't, I think there are services, like company services in Kenya, who receive Amazon stuff on behalf of people. I don't know. You guys know better. You live in Kenya, so let me find out.
But if that was the case, then you can buy any NCLEX book on Amazon. Okay.
So can they buy? What do you buy? Do you buy the practice test or do you buy the study? What do you do?
Can buy a book with a practice test with rationales. So when you read a question, you make a choice and then read the rationale.
So there will be books for rationale and then there are books for same? It's the same? Okay.
It could be that maybe at the back where there are answers, then they give the answers and rationale. And the rationale will give you the reason why choice A was wrong, why choice B was wrong, why choice C was the best answer, and why D was wrong answer.
Okay. Oh, wonderful.
So then that it broadens your understanding about NCLEX questions.
That's wonderful. So the reason we are talking about nurses coming here, why are there opportunities? To tell us. Are there opportunities for nurses?
I don't know how a nurse is paid in Kenya. I think if I'm not wrong, you guys can correct me because you could be doing better,
Yeah,
right?
yeah.
But I know they get paid maybe even some are 20,000, some are 30,000, some are
50.
40, 50, to maybe 100 the
100.
highest, maybe in big cities like Nairobi.
Okay.
Now, 100,000,
$1,000.
that's $1,000.
Mm-hmm.
That a nurse can make in a week.
In America.
Yes.
Mm.
So